So Amanda came back to see me today. Thank God. I didn't finish her off. I gave you treatment about 2 weeks ago, didn't I?
Yes.
And thinking about how you were presenting the symptoms that you had. So lots of lumbar discomfort, lack of energy, just generally you felt like almost stagnant, didn't you?
Yeah, I did. And I think it's a fatigue of the constant pain.
Yeah.
And I was having the sciatic a little bit down my leg as well.
Yeah.
And so it just made me feel lethargic and not really wanting to get on and do things. As I don't know, when you're carrying a lot of pain, it overtakes your brain, doesn't it?
Yeah. So this is the thing about when we say to people you need to exercise. It's very hard to tell someone to do all of these things which we know are good for us if the body is saying don't do anything because the brain's, kind of giving you the message that there's pain there.
Because you're already in pain.
You're in pain.
So doing any more feels like it's going to be a threat.
Yeah, exactly. Once you've found the source of it physically, you then need to think about the original source, okay? Because actually what your body is doing is it's telling a story, okay? And that story can relate back to trauma, it can relate back to poor diet, it can relate to many, many things. So we have to recognise that you're not just dealing with someone physically, you are dealing with them mentally. So we had this lovely little breakthrough because you came, you had a treatment and you felt pretty shit after, didn't you?
Yeah, I was hoping to feel the release of the pain and the tightness, and I didn't. But I did over the next 2 or 3 or 4 days, and it got better and better to a point where I'm walking and I'm going out in the morning. I'm actually, because I don't hurt to put my leggings on, because that was the other thing, trying to get your leg in, everything's painful.
Yeah.
And it's just got better and better, and the snowball effect has been incredible because I'm now exercising a little, I'm eating better, I'm sleeping better.
All of the things start to fall into place.
So this chain reaction, the body seems to be,
well, as soon as you alleviate pain, the shift in attitude changes. You just feel a lift. One of the best cures for depression is exercise, and that's been proven, we know that, but like I just said, it's hard to get people to exercise when they feel so low. So it's no different with pain and discomfort.
And the pain the brain focuses on the pain, should
Absolutely,
I say?
yes.
So you don't feel like you've got enough capacity to think about doing anything else because you're trying to get rid of the pain.
Just demotivates.
Yes.
Yeah. Totally. It almost sucks away all sensibility and you can't see beyond it.
And I started to live with it.
Yes.
Yeah. I thought that there was no real way.
You normalised it.
Yes, normalised it.
And I challenged that. I said, actually, you're too young to be feeling that. And I also know how vibrant your personality is. It's a rebalancing act when you get clients on the couch. You know that you cannot just go to the place that the patient tells you is hurting. You have to be curious, so you have to look holistically at the body. I looked at L45 and I looked at the lumbar area, but then I looked into the glutes. Amanda reported that she was having pain down the side of the legs, which immediately you think of sciatica. It wasn't sciatica, it was piriformis syndrome, which is a little muscle that sits in the glutes. If it gets inflamed, it can irritate the sciatic nerve, and that can make you feel like you've got sciatica. So many people are suffering with sciatica and they haven't got sciatica, and you can fix it sometimes in 1 or 2 treatments. So we did the follow-up treatment today. We found a lot of the same things, but your response wasn't as heightened, was it?
No, it wasn't. And I also didn't feel the twinge in my back when you were doing the psoas lift.
So Amanda just mentioned psoas, which is absolutely key. When you're dealing with any lumbar discomfort, any practitioner you see, they have to test psoas. If they don't test psoas, it could be the missing link, and it is normally involved. So you test psoas. I tested psoas with you today, and it was literally locked down.
Was it?
It didn't want to lift. So immediately you've got to get that moving. And then the glutes, the work you do on the glutes and in QL, quadratus lumborum, which is the muscles that sit just above the lumbar spine, they start to free off. They might have felt a bit better for a little while, but without moving psoas, getting that moving, it wouldn't have lasted. Now, you feel more positive.
I do.
So now you can start exercising.
Yes.
Yeah.
And it's incredible that I never thought a treatment on a couch would make that type of difference.
And also for your life in general, because your work as a model and a presenter, you rely on your body.
Yes.
You know, your body's got to be in top condition.
And holding back the pain visually.
Yeah.
So if you're in pain, you can't go,
oh. Of course. and actually it becomes transparent eventually, because disguising pain is, well, people learn to do it. But in your role, it wouldn't have been easy in the long run.
No, and I think does that feel like it's an added blockage as well? So you've got the pain blockage, and then you're not able to release it visually either. So you're blocking that as well.
Yeah, that's interesting. You're having to contain it. And you actually had thought, I think you were getting to the point where you were thinking it was something much more serious.
Yeah, because I'd been and had an MRI, as we discussed. I'd been to some physio and osteo and chiro and had a little check with different people, and nothing really was coming to any decision. And so I thought, okay, well, the only other option would be the L4-5, which they said had some wear and tear. Do I have some sort of major surgery? And that, you think, I don't want to do that. No. It's all too much.
No. Surgery is amazing as a last resort.
Yes.
Any kind of discomfort or pain. It becomes chronic. You learn to live with it. Don't learn to live with it. Challenge it. Ask yourself, what is my body feeding back? Every single message that comes through is there for a reason. It's there to make you think, okay, there's something malfunctioning here, so I need to address it. And it's so simple. I guarantee that one more treatment for Amanda, maybe in a month, okay, we'll leave it a little bit longer. One more treatment, she will be firing on all cylinders, and then it will just be a little bit of maintenance, because at our age, that's what you do.
Yes. And
exercise will be the cure.
Wonderful.
Yeah, and you'll be bouncing around like a little spring lamb.
Well, I have to say thank you so very much. It really has changed the way I feel. And a time in my life, you know, when you're getting into your 50s, unfortunately, there's the menopause that comes along with it.
Yeah.
And so there's a lot of sense of aging and change and, you know, acceptance of your body that you're getting older.
Yeah.
But actually there are clearly things that you can do to really help yourself. And that you don't
have to accept. Menopause, like you said, menopause, and I know you know a lot about menopause, that plays a huge part on how we experience different things within the body. It can create a lot of tension for some women, achy joints.
Yes.
I mean,
it's huge.
But we don't...
Is it estrogen? I think the lack of estrogen causes a...
And frozen shoulder, there's like an epidemic of frozen shoulder, right, of women in their 50s. Because they hit menopause, the estrogen levels, which is an anti-inflammatory hormone, estrogen, which we're not normally aware of.
Right.
So once those estrogen levels drop, if you're not on HRT, the body starts to tell the story, and we do suffer. So we don't need to. Good. So yeah, it's all good. Thanks, I've only just started posting some of these on YouTube, but I am on Instagram at A Coach for Life. And my website is isabelcripps.com, which is ISOBELCRIPPS. So you can check out my website, because I write lots of things, but I'm really big on stretch. I'm really big on actually encouraging people to do 5-10 minutes of stretch every day to prevent a lot of this stuff from happening. Right. And now Amanda's got a brilliant little stretch program.
I have.
A little bed stretch program. Actually, you don't even have to get out of bed to do this one. So yeah, there's lots of little tips. I'll be doing lots more. So if you're interested, follow me.
Follow her.
Yeah. Over and out.